Pain relief. What pain relief have you considered in labour? Now, we can start off with the different types. You have pharmacological types, and then you also have natural types of pain relief. Now, some of the pharmacological pain relief that we use in labour can start off with something called paracetamol. Now, paracetamol you can use in early labour to help with those period-like early contractions. Now, you can take 2 tablets based on your weight. If you're over 50 kilograms, then you can take 2 tablets every 4 hours, with not exceeding more than 4 grams in 24 hours. Now, the benefits of paracetamol is it can take effect usually up to 20 minutes, but one of the downsides is actually it's noticed that some of the side effects of using paracetamol in early labour is there's some evidence to show that actually it can slow down the production of prostaglandins, and as we know, prostaglandins are vital in that early stage of labour because it helps to soften your cervix. The type of pain relief that we can discuss is the TENS machine. Now, the TENS machine is something that you can use, and you can buy it off Amazon or online. Different types of shops sell them. Now, the TENS machine I've noticed in some women is really useful, and the reason being is it's like a small electric shock that sends waves into your back. So you place the pads on the back, and you notice it in different places of your back, wherever you feel it will be most helpful for you. And what it does is it sends small shock waves through the pads to help ease with that pain relief. What they do is there's pads attached to the monitor, and you attach the pads on your back, and once you place them on your back and press the play or go button on the device, then you'll notice that it will send small shock waves throughout your back to help with that labour pain. It's more vital, I've noticed, in some women who feel that they get a lot of that back pain during labour. Now, this can be really helpful in the early parts of labour, and some women feel that actually once labour has intensified, the contractions become more stronger, actually they might need more pain relief. Some women I've noticed who use this all the way through. Please note though, you cannot use this if you are using a pool birth or if you're having any water during your labour or birth. Now, the next great thing for pain relief is a water birth, or even a water labour. Now, some people don't want to have a water birth, but actually find the use of water really helpful during as pain relief. Now, water is really helpful for pain relief because it helps with the buoyancy. The buoyancy of the water helps relieve that pressure on your pelvis when you're starting to go into labour. If you think about when you're having period pain and you have a nice relaxing hot bath during those period times, it's very similar when you're going into labour. So pain relief such as water can be really effective. Please note though, you may not necessarily be able to have a water birth or a water labour depending on your risk factors, so it's really important that you have this discussion with your midwife. Next thing is Entonox. Now, Entonox is also known as gas and air, or the laughing gas. Now, this is provided in most hospitals, and if you're having a home birth, the midwife can also bring this to your house. Now, Entonox is really effective because it is short lasting, and all you do is basically breathe it in. There's an apparatus that you take over your mouth, and you take nice deep breaths in. This helps to slowly help. There's an apparatus that you put into your mouth, and you breathe it in and out slowly. Not only does this help with the breathing exercises throughout labour, but it also can help with you to calm that breathing down. It can be scary during labour, and sometimes you can feel like your breath goes quite fast, so it's really important actually slowing that breathing down, and using a device such as Entonox can really help with that. Entonox is short lasting, and once you have stopped breathing it in, it starts exhaling from your body quite quickly. Now, you would only use this when you have a contraction, so that rest period in between those contractions, you would breathe in normal air and you wouldn't use the Entonox device. The next type that we use is pethidine, or some hospitals use something called oromorphine. I'm going to talk about pethidine. Pethidine is an injection that we give, and it's from the same families of opioids. And what it does is it helps to completely relax your body. And this is what we need when you start going into early labour. And the reason for this is because the more relaxed your body is, the more those prostaglandins can start kicking into effect, and also your oxytocin can start being utilised to start those contractions. When you're tense, your body can't relax, and your prostaglandins and your oxytocin working on those smooth muscle fibres can't have effective contractions. So the more relaxed you are, the better. We talk a lot about the environment and having a calm environment to help you progress in labour. Pethidine tries to do this. It is an opioid, so some of the side effects is you can feel nauseous and sort of like a drunk, out of control sensation. What we usually do is we put a anti-sickness medication with it, so it relieves that feeling of being nauseous. Some women notice that actually when they have the pethidine, they can have a few hours of sleep in between those contractions. They're getting that rest in between. It usually lasts about 4 hours, and you can have another dose if you wanted to. One of the side effects of this is because it makes you so drowsy, it can pass through the placenta, so it means that baby can be sometimes drowsy. Now this is only a problem when we give it to you quite late in your labour. So if we know that your birth is going to be imminent in the next 4 hours or so, we won't give you that pethidine injection. The reason being is actually we want baby to be quite alert when they're born, because we need them to take that nice deep breath in and oxygenate their body when they first are born. Now, an epidural. An epidural can only be available on the delivery suite in an obstetric-led unit. And this is one of the last types of pain relief that we offer to pregnant women. Now, it is done by a specialist called an anaesthetist, and they basically put a small needle into your back and connect a device similar to a catheter, remove the needle from your back and keep that catheter in. It's usually in between 2 of the spinal bones in your back, and that catheter is connected to a drip which slowly releases that epidural pain relief. Now, most epidurals in the UK are called walking epidurals. This doesn't mean we're expecting you to walk a marathon, but it means that you're quite mobile, which means that you can still change position in labour. You will end up having a catheter once you have an epidural, and the reason for this is because we're not expecting you to walk long distances. We can help you to change positions into all fours, sitting up, on your back, on your side, whatever might be comfortable to you. Always remember though, gravity is your best friend in labour. So even if you have an epidural, try and remain sitting upright and remember, is gravity helping me in this position? Gravity is your best friend because not only is your body working hard with the contractions to get baby out, but the gravity is also helping. So your contractions are working hard to push baby out, but gravity will also help push baby out. Now, one of the downsides of an epidural is sometimes it can slow your labour slightly. And what we mean by this is because you're less mobile and because you're less active, sometimes this can reduce the amount of contractions that you have. You can have an epidural all up until 10 centimetres. I've known some women to be at the pushing stage and ask for an epidural, and they can still get an epidural, but it may not necessarily take effect. The epidural works on the abdominal contractions, not the pressure that you feel down below. So what we usually say is that pressure sort of feeling like you need to go for a poo, that doesn't go with an epidural. The abdominal contractions, it does. Let's recap. You have natural types of pain relief, and you also have pharmacological types of pain relief. Let's review the natural types of pain relief. You have walking and mobilising. You have massage, so utilising your birth partner to give you massages at the bottom of your back. Touching, stroking can really help. You also have breathing techniques. Now, breathing techniques are great, and one that I can go through you now is a slow breathing technique. So what I usually say is in for 4, out for more. So the best way to remember this is take a nice deep breath in with me now and count to 4. And then come out. And that just helps to slow down that breathing, but also helps you to gain control. Some pharmacological pain reliefs that we can think about is obviously the pethidine, the Entonox, the epidural as well. So it's completely down to you and what you think's best, but when thinking about your birth plan and the pain relief that's offered to you, it's thinking about how you might feel in that situation. So sometimes what I say is try and mimic what your labour might be like, the environment, the people around you, and having those conversations of actually, I might not want an epidural now, but if I needed the hormone drip or if I feel like I'm not coping, I could consider this. And it's having that conversation early on so the midwife looking after you can prepare for this, but also listen to your views. Thank you.